Curious how you know if it's the right time to think about Botox? Today, I'm going to share with you the 6 questions you need to ask yourself to make sure you come to the right decision. Stay tuned. Hi, I'm Dr. Sam, helping you get closer to great skin days, just like I've done for thousands of patients in my Harley Street clinic. Now, it can be really challenging knowing when it is the right time to think about Botox. There are so many myths and misconceptions. What's the right time? Where should you have it? Who should you have it with? Well, today I'm going to give you an easy to follow framework so that you come to the right decision for you and your skin. So the first question to ask is, are you getting lines that occur from facial movements that don't disappear when the face is at rest? Now, when I'm assessing a patient who's asked me, Dr. Sam, is it the right time for Botox? I get them to do a variety of facial movements. I'll get them to frown down, bringing the brows together to create the 11s. I'll get them to raise the eyebrows up to create lines in the horizontal aspect of the forehead. I'll get them to smile. I'll also look at how their corners of their mouth are working. Are the corners downturned? Do they have furrows in the upper or lower lips? Are they pebbling their chin? Is their masseter overactive? And do they have platysmal glands? These are all common places that we use Botox. But by far and away, the most common is to address the upper face. So is the facial movement creating a line? If the answer is yes, then yes, Botox is on the menu. The second question is, do those lines bother you? And this is incredibly important. I have patients who only ever treat the frown area because they don't like how that movement and then the lines indicate to the world that they're frustrated or cross or, something's not right. They're dissatisfied, when oftentimes they're frowning out of a habit. They're not actually frowning because they feel those emotions. So it's creating an emotional disconnect between how they look and how they feel. Oftentimes, they will also have crow's feet and horizontal facial lines, but those lines won't bother them because they don't have these sort of disharmonious cues. They're not kind of indicating something different to how they're feeling. So really, at the end of the day, there is the objective assessment. So yes, you could have Botox here, here, and here, but there's the subjective, how you feel about the lines. So really, it's about changing things that you think will make a big difference to how you feel. Now, question number 3 might be, is there an alternative? Something that many people want to consider. Is there something else I could be doing instead? Now, I will almost always have had a discussion with the patient in front of me about skincare, because first and foremost, that is what I want people who come to my clinic to benefit from, because everybody will look better when their skincare game is up to notch. But Botox might be on the menu as well, but generally speaking, I put the skincare regime in place. You are never going to be worse off by doing that, because when you make the skin thicker, which is largely the focus of any regime that's designed to tackle premature aging, you are making the skin more crease resistant. Think about thin fabric like chiffon versus cardboard. If you crease one, it etches lines into it easily. You crease the other, it's much more resistant to those creases. So thickening your skin with good skincare that promotes collagen is always going to be a good thing. Now, that said, really strongly entrenched, frown lines or crow's feet, because you may have been frowning since you were very little. Children pick up on facial mannerisms from their parents. So by the time you've got to your 20s or 30s, those lines are often going to be quite strongly etched in. So really, an intervention like Botox that gets to the root cause, which is that repetitive muscle action, is going to be the thing that's going to make the biggest difference. Next, ask yourself, is there any medical indication as to why I shouldn't be having Botox? Now, the commonest reason to not have Botox is probably going to be being pregnant or breastfeeding, in which case we don't perform Botox. Otherwise, there are a few rare contraindications, such as certain neuromuscular disorders like myasthenia gravis, certain drugs like aminoglycoside, antibiotics, and muscle relaxants. But on the whole, Botox is a very safe treatment, but ensure that whoever you're seeing to have your treatment has a thorough discussion with you about your medical background. That's an important part of your assessment. Now, the next question is to determine whether you are someone who is at higher risk of problems from Botox due to your anatomy. Now, that's something, again, to be discussed with the practitioner who's about to do your treatment. And ideally should be a conversation had separate to you going in to have your treatment. This should be done in advance. So people who, for example, have heavy brows, now that happens over time. It's just one of those things that can happen as we age. We get a degree of brow ptosis. And what that means is that you can end up trying to target horizontal forehead lines and actually making that worse if you treat the brow inappropriately. In addition, things like lid ptosis, somebody who's already naturally got a lower sitting eyelid, if then we try to target their frown lines with treating the glabellar complex, that can sometimes worsen ptosis. Facial asymmetry can sometimes be exaggerated with Botox when it's not properly considered. So these are all quite subtle things, they're nuanced, but it's important to have a discussion about whether there are any specific extra risks based on your anatomy, and a good practitioner will have that conversation with you. Now, the last thing I would urge you to consider is whether there's a specific timeline to when you're thinking of having treatment. Now, that's important for two reasons. One is that if you have a big day ahead, like a wedding, for example, I would almost always suggest having a treatment at least once before the treatment that you would have for the big day, so there are no surprises. You know exactly what things are going to look like, and how your brows are going to be positioned, for example. That's not something you want to leave to the last minute. So once you're engaged, think about having at least one cycle of Botox where you go back for a follow-up at 2 weeks to make sure that your treatment is perfected, so that you don't have any anxiety around the treatment that you're having before your wedding. Similarly, if you have a big event coming up, know that Botox does not work overnight. It's not the quick fix that you might associate with something like a dermal filler, when you literally fill the lines and what you see is to a large extent what you're going to get. Botox kicks in at 3 to 5 days after your treatment, and I won't see someone back until about days 10 to 14. And you're probably going to see the best result between days 14 and the end of the first month. So it's going to have a gradual switching off of the muscle. It doesn't mean that the lines that you've already got are going to disappear overnight. They're going to take some time. They're going to work, it's going to work best with your skincare regime to help lift any existing lines that you have from muscle contractions of old. So know all of that before you have your Botox treatment for the first time, so you get the timing just right. So at the end of the day, I think Botox is a fantastic treatment. It's certainly the one that I do most often in the clinic. And I think it's the one where you can subtly enhance a face without anyone really knowing anything's been done. You can take away a sort of tired, slightly irritable look to the face, make everything just look more serene, more relaxed, and ultimately help keep attention in the central part of the face. When someone has very active brows or a very active frown, it can be quite distracting. And when you've put a lot of effort into your skincare to make your skin look wonderful, we want people's attention to stay in this central part of the face. So I think Botox really can be a fantastic treatment to aid that situation and really make your skin and your features sing. So I hope I've answered all your questions. I hope I've made it easier now for you to see whether or not Botox is the right treatment for you. And if I haven't answered all your questions, please drop them in the comments down below. And I'll see you again soon. Bye for now.